Shortly before the release of this podcast episode, our community lost a real giant in the one-piece dental implant space. Dr. David Powers was not only a close colleague, but more importantly, he was my friend. His presence is greatly missed. I am honored to have recorded this podcast with him, and the insights he shared will inspire us all. Enjoy. Welcome to the One Piece Implant Mentor Podcast. I am your host and mentor, Dr. Andrea Joy Smith. The One Piece Implant Mentor Podcast introduces the audience to pioneers leading the way in one-piece dental implantology. And it also introduces you to doctors who are successfully placing one-piece dental implants on a daily basis. My guest today is Dr. Dave Powers. Dr. Powers is currently in private practice in San Diego, California, but his dental journey is far from ordinary. He has owned an implant center and has worked for implant centers developed by one of the true pioneers of this procedure. Dave, welcome to the podcast.
Thank you. Glad to be here.
I'm so glad to have you. We'll just start with the start of your dental journey. How long have you been practicing dentistry and what year did you graduate?
I graduated from dental school in 1991. My journey was I went into private practice with my brother, who was a general dentist already. We worked together for about 18 years, and then we split up, and I went off on my own in 2012, and then I took off and started doing my own general practice and did a lot of mini implants, then went off on to my next venture in a group practice and implant center. And I've been doing these wonderful, wonderful procedures for about 20 years.
That is really, really awesome. So, Dave, did you ever place conventional implants?
I did. I placed Nobels and I also placed Icons.
And what was your general experience with conventional styling?
I had great success with them. I had no problems with them. The learning curve was there. I found the most difficult thing for me to do was to actually sell the implant to the patient. And then once I was able to sell the implant to the patient, because of the cost and the time and the pain involved, and what I found was, after I discovered the small diameter implant and one-piece implant, is that the patients, a lot of them don't have enough bone to do the traditional type implant.
Correct.
Or very poor quality. And we didn't have any answer for that. It was very difficult to get in there, open up a ridge and find that there wasn't enough bone. And this was back when we had only panos to go off of. We didn't really have CT technology, which has made things so much easier now. CT technology enables us to basically pick out the size of the implant that's going to fit the bone that the patient has without having to flap the area, measure, and do that kind of procedures. The evolution of dental implants has, as you did so well in your podcast of showing some of the history of implant, and the bottom line is all medical procedures, medical and dental, are getting less and less invasive. It allows the body to heal faster, easier, with less pain. As a dentist and as a patient, I appreciate that more than you know.
Absolutely. Well, one of the things I love about the one-piece implant, the small diameter implants, is that it really does increase access to care to patients who are told they're not candidates for it, either because they don't have enough bone or they don't have enough money, but mostly it's because they don't have enough bone, because every conventional implant is larger than 3 millimeters in diameter or maybe even larger. And patients often, if they've been missing their teeth for any length of time, they are not walking around with that amount of available bone. And so rather than having to mold and create bone to fit an implant, it is nice to have an option to fit an implant that already fits their bone. I think you alluded to it earlier, but what really attracted you to this one-piece small diameter implant procedure?
Being a dentist and using the traditional implants and going through the surgical techniques, the preoperative setups, the cost of the preoperative setup, the cost of the training on my side. And then when I actually was doing the traditional implants, the time involved in doing it. And as we know, we love to have these great care for our patients. I always say, no matter what it costs you, you got to do it right. We have to make money at this, and time is money. And I found that when I was doing these implants, there wasn't a lot of wiggle room in case something went awry. The traditional implants were expensive. The instrumentation we got expensive and very complicated. In the middle of my implant journey, I went to a mini dental implant course, similar to yours. About 20 years ago with the MTech implant, I was taught denture stabilization. And at the time, the instructor in the class was actually just starting to put teeth on these, single teeth.
Mm-hmm.
And I got an idea. I had my mom who had a partial on the bottom, missing 4 teeth. And I said, hey, let's try and do this on my mom. So I got to actually do my first mini implant case, and it wasn't a denture case. I had already done a lot of mini dental implant stabilizations at the time, but this was my first fixed case. She died, unfortunately, 2 years ago, but I'm proud to say that it stayed in her mouth for 17 years.
That's awesome. So what impact do you think offering this minimally invasive technique has on your patient's quality of life?
Well, I see that every day, Andrea, just from the first consult going forward, explaining to them how much easier this is. First thing you can explain to them is you have a solution for them. They've been to half a dozen other dentists that have said, hey, you don't have enough bone. You don't have enough jaw structure. When they come to me, I said, and you alluded to this in your podcast, if you got chin, I can get them in. And I just love that saying that you put in. But the point is, these patients have been told no, 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 have been suffering with loose dentures or not being able to chew. Mm-hmm. And I can tell you from personal experience, I've been missing 3 molars at one time, and it was horrible for me to chew. Absolutely. And I can't imagine somebody not having a full set of teeth and being able to chew. I have a lot of empathy for my patients, so I want them to get the best treatment that's going to enable them to be comfortable in what they're doing. And when they sit down in my chair and I tell them, yes, I can help you, the look on their face is just utter relief. I get tears at the first appointment. I get tears at the last appointment. It's the greatest feeling in the world. We can change patients' lives because these patients do not have anywhere to go.
Absolutely. I agree with that 100%. So if you think about a dentist who is considering starting to place one-piece implants, but they've been hesitant, maybe they've heard something that's not correct, maybe they haven't read an article since 1966 when the first small dental implants came out, and so they see them as temporary. What advice would you give these doctors as it relates to starting to offer this procedure to their patients?
That's a great question, Andrea. What I'm going to tell you is this. I understand the people being very, very apprehensive because their oral surgeons are telling them that they don't work, that mini implants are temporary, because they did come out as interim implants in the beginning. And what we found was if we were able to coat them with the correct material, they actually integrate into the bone. What I would tell doctors to do is understand that there is a learning curve with these, but the learning curve is not going to hurt you or your patients. The wonderful thing about mini implants or small diameter or one-piece implants, not only are they easy to place. Planned out correctly, they are very easy to place.
Correct.
When things happen, and they do happen in every implant system.
Absolutely.
The ultimate determining factor of any implant system is the body's ability to accept the implant, heal, and grow bone around it.
Absolutely.
That's across the board. But the nice thing about minis is that the patient's body doesn't accept it. They get a little loose, you unscrew it, you let it heal, and you put another one in. Absolutely. It's the easiest fix there is. You can imagine having a traditional all-on-4, all-on-6, blade, whatever type of other traditional implant system. If something goes south and you have an issue, it's all-on-4, none-on-3.
Absolutely.
And so you have to start all over. And what I've seen in my 20 years of experience of the traditional implants, it takes longer for a traditional implant to deintegrate, for bone to be lost around it. But when it does, there's no bone left. It completely destroys the bone in there, so you can't put another implant in there.
Absolutely.
Without grafting, and even grafting, trying to grow vertical bone is very difficult.
Absolutely.
So you have to go something else. So I'm getting patients in my office that have had all-on-4s, all-on-5s, single-tooth implants that I've been able to correct with the minis because we didn't need as much bone.
Absolutely. I've rescued my fair share of nothing on 3s in my time that I've been doing it over the last 16 years.
Yeah, and you probably could use the conventional implants in that
Absolutely. Absolutely.
combination.
I do.
Yeah, it's the greatest thing.
It really is. So what impact did offering this procedure have on your practice? You alluded to before that it was hard to sell one conventional
Yeah,
implant.
it was very difficult because all the people that were coming into my office from other dentists would be said, oh, I have to go to an oral surgeon and get the implants in, which is why dentists now are putting in traditional implants because they're finding that the oral surgeon, they do great work. I have nothing against traditional implants. I love them. I'll restore them. I'll do it. I just don't want to place them. I haven't found a place where I've had to use them
Right.
anymore. I've used the one-piece implants for everything.
Yeah.
And what I have found is that the money stays in my office.
Mm-hmm.
Not only that, because I am rebuilding this person's mouth, I am the general contractor of their mouth. The specialists are the subcontractors. So when this subcontractor comes in and puts an implant in, I have to make it look good, chew well, and do everything that it's supposed to do. If the foundation goes out, the implant, I have to take the brunt of that and start over and figure out a way to fix that.
Absolutely.
I want to have the control of being able to fix it and also have the revenue coming into my office.
Yes.
That I was able to do all of the work. I am a dentist that does everything. I'll do everything from endo, perio,
Yes.
wisdom tooth extractions, every surgery you can imagine. But you don't have to be.
Right.
These mini implants will enable you to do less physical work and make more money. And the best part is you're changing people's lives and they actually smile at you. How many of your patients have said, I hate the dentist, I hate you, I hate dealing with it. When I get done with my patients, they're like, that was the easiest thing I've ever had done.
Absolutely.
And they're happy. And you have a patient for life, I'm telling you. And it's a wonderful, wonderful feeling, not only for the patients, but for you too. You go home smiling, you feel great every day, you're making money, you're not stressing out as much. It's changed my life. In the last 20 years, I can tell you, I have not labored as much as I would have if I would have stayed in the general practice without the small diameter implants.
First of all, patients like to stay in your office. They trust you. If you can do that root canal, if you can do that extraction, you don't have to send them out somewhere else. That is a very high draw of them to your office. They're going to want to stay there. So by being able to solve multiple problems, like we said, implants can't solve every problem. And so we have lots of patients with other problems that we can fix as well.
Absolutely.
So that is great.
That's a great point that I want to bring up, Andrea, is if you have a general dentistry practice, you don't want to send your patients out to anybody. You want to be able to do everything. And this is one thing in your tool belt that is easy, inexpensive to get into, and very profitable that you can put into your practice, implement it, and you will find it will do wonders for the revenue stream.
Absolutely. That has been my experience as well. Now, I heard you say earlier that you were missing 3 molars. Are you still missing molars?
No, I'm missing 2. I'm missing 2. I've got to put those 2 implants in for myself.
You put them in for yourself. Can you tell us a little bit about how that came about? And maybe is that just a testament to how simple these procedures are?
Yeah, for sure. If any of these doctors watching this want to see me put my own implant in, they can go to YouTube, and it says Dr. David Powers puts his own mini implant in.
Oh, wow.
I did my front tooth, and the place I was working at before, I was actually a treatment planner for guide stents. And using the Blue Sky Bio, I was able to have doctors send in their cases to me, and I would plan the cases with the small diameter implants, and I would actually fabricate guides for them. And so I was able to do that for myself. I basically brought my CT up. I was able to fabricate the guide, and I put number 18 in, and I also have that on video. It's not online, but I have that on video. And I did that in front of about 125 dentists in a live surgery situation. And I was basically telling the reason for doing that was not like I had a big ego or anything. I just like how I do my work. You know, I want to do everything myself. It has nothing to do with not trusting anybody else. Absolutely. But more than that, I wanted to show doctors how easy the procedure was. And not only did I plan it, place it, I also had the crown made, put the crown in immediately. So 18 is in there. I lost 19 and 30 to worn out endos. They just wore out. The tooth wore out. So we had the teeth taken out. And I'm getting ready to put those 2 in now.
Well, I tell people all the time that root canal buys us some time. They may not last the lifetime, but they buy us some time. And I also tell them that no matter what procedure you're having done, whether it's a crown, a root canal, an implant, they all come with the potential to be in the 5% that don't always go as planned. And you alluded to this earlier. The key is being able to fix it, and the fact that it's not a catastrophic failure when something does
Correct.
happen. You're not finding out an implant most of the time. So
Right.
I think that's a great point to bring up too.
Yeah, I'm going to sum that up in a very, very easy thing to remember.
Okay.
Everything is temporary. Everything. Life is temporary. I tell some of my patients that come in, I said, you're just outliving your teeth. You know, your teeth were made of a certain amount, you're just outliving them. So what I tell my patients is the body is going to wear out. No matter what I put in there, it's going to wear out. You may get lucky and not ever have to replace something, but there's other things that you will.
Absolutely.
And you just have to accept that.
Absolutely. And being able to fix it with all the experience that you have and all the experience that I have, there's very few things that can walk in this office, one-piece implant wise or otherwise, that we can at least find a solution for. In fact, you know what sent me on my quest to do one-piece implants? It was one patient that I had done my version at that time of a full mouth reconstruction. She had about 4 teeth that were savable up top, so we crowned those. We made a beautiful Val Plus partial, but there was nothing on the bottom that I could save. So I made her a conventional denture. When I made her that denture, she didn't wear it. It didn't fit. She stopped her social life. And for 2 years, because I did that case in 2005, for 2 years, she didn't go to her daytime parties. And when I saw this information about stabilizing dentures with mini implants, I went to that course, and that was the very first case that I did. So we are really, truly doing something that could not be done before in this simple of a way.
Absolutely. I agree with you 100%. I've had cases like that, and I'll tell you what, the most important thing I believe is discussing with the patient the future possibilities. Do not just sell them the product. Do not just sell them the procedure. Exactly. Sell them on the fact that this can be temporary. Yes. Even traditional implants. Even when I do a filling on a patient, I tell a patient it could be temporary. You may need a root canal on this tooth. Exactly. I am very open and honest about all my treatment, and patients feel good about that because they know I'm thinking about their future. I'm not just saying, okay, you're done with this procedure, you know, I'm putting a warranty on it or a time frame on it. There's no way you can do that. I mean, it's just impossible. So if doctors understand that they have to be upfront with these patients, when they go into the procedure, they're going to have a lot less stress on their head. Absolutely. About thinking about, oh my gosh, what if this doesn't work? The fact is you've discussed it with the patient.
Those are some excellent points, Dave. Is there anything else you'd like to share with our audience? A lot of our audience, they've never met anyone who's doing one-piece implants before. And that was one of the motivations for me doing this podcast. I called up 20 of my colleagues, and I've interviewed about 17 of them so far. And we all have come to the consensus that before offering this service, patients did not have access to care. Our practices were not as profitable, and we just couldn't help that patient that couldn't wear that denture. For 2 years, my initial patient, I couldn't help her. I referred her to see about getting the traditional implants with the bar. That was too cost prohibitive even back then. That was back in 2005. Of course, things have come down in price now, but it's still one of those procedures where if you don't have enough bone, you're not going to be able to do it.
Yes, but you know what? The mini implant will give every patient with minimal bone or have been told they have minimal bone a chance. Yes. And I'm willing to try it on everybody because they have no other choice. And I'm willing to take that chance with them if they're willing to take it with me. The whole idea of this is not to injure a patient, and you can't with these. It's nothing that's going to bother the patient that can't be corrected. Unfortunately, the history of dentistry sounds like we have to make everything last for 25, 30, 40 years. It's just not like that. Yeah. The world is changing. People are losing teeth. People with dentures, the things that they has to go through just to get a stabilized denture, they'd have to go in the hospital, have their mandible completely degloved and these huge blades and staple implants put in. And now that we have something so simple and so easy to help correct their situation, they should be running to us to teach them how to do this wonderful procedure to make their patients feel so life-changingly better.
Absolutely. So, hey, Dave, tell us what's on the horizon for you. You and I have been practicing almost the same amount of time. I have that enthusiasm for practicing dentistry, much like you still do. What's on the horizon for you? What keeps you going?
What I would like to do is I would like to continue doing the treatment planning and stent fabricating. I'm in the process of doing a little situation with that, and that's to be announced. But I can tell you that the design of the implant, the usage of the implant, the many prosthetic options that you're going to have. There's some great new materials coming out. We have the Xantex right now. We have zirconia. We have the denture hybrids. And it's not only in the mini small diameter implant in one piece, there's also in traditional size. And another thing that is coming on the horizon is the one piece traditional size implants. I'm placing traditional size implants with abutment heads on them that are 3 millimeters all the way up to 5 millimeters. And I'm doing it right through the tissue and getting them to lock in at 30 Newton centimeters, and they're working wonderfully. And they work great on immediates and whatnot. So those are the things coming. I think it's going to get easier to replace teeth with people that have minimal bone. Obviously, before this podcast, we were talking about the very invasive surgeries that are happening because of people with no bone. Absolutely. And unfortunately, they're out there. They need help too, but at least they have something. So we're seeing, I believe, an advancement in things being much, much less invasive, much easier to do, and much easier to correct. And the important thing is getting the education for the doctors of not only how to put these in, not only how to restore them, not only how to talk to the patients,
right,
but also how to correct the situations. And that's where I come in. I've been doing this for 20 years. There's nothing that has happened in my dental practice with mini dental implants over the 50,000 that I've put in that I have not been able to correct.
Wow. And that's saying a lot, because it has a lot to do with, one, your skill and ability, but it also has to do with the nature of this particular implant, because it does not require catastrophic disruption of the blood supply or anything.
No, it's wonderful.
Well, Dave, thank you so much for sharing your experience on the podcast. I look forward to connecting with you in the future with some case planning endeavors that we could do together, some troubleshooting endeavors. I would love to work with you. Hey, that 2 or 3 months that you spent with me in my office was the most special
time I had a ball.
I remember. And I want to say that
I had a ball.
You are actually my very first one-piece implant best friend. I met you in January of 2012, but then later that year in May of 2012, you spotted me on the walkway at a CDA meeting.
You were in line at the food truck with your husband, right. And I walked up. I wanted the same food, and I saw you.
Absolutely. And we talked for 35, 40 minutes. At that point, I've been practicing dentistry for about 18 years. And when you left, my husband said, I've been coming to these meetings with you for years. That is the longest conversation I've ever seen you have with another dentist, other than your 3 or 4 friends that are also dentists, since I've known you. He goes, that guy was great. I said, yeah. I said, this whole group that I've met back in Buffalo is great. And it's just been the beginning of a great journey.
Yes, my dear, I have enjoyed having the relationship with you with this mini dental implant journey. You've been a great mentor to me. You've been a great educator to me. I get excited about this stuff. It's very hard for people outside the dental world to understand how excited we get when we're talking about these things. And being able to have colleagues to talk about these things is the most important thing. I think we developed in the mini implant world is some camaraderie amongst each other. Because we are being bombarded with everybody around us saying that this doesn't work or I have problems and I can't fix it, all that. I said, listen, we have the answers for you. You just have to ask. We're not trying to hide our ability and our experience. We want to help you through this experience. And if we need to handhold, we will do it through your residencies, through your mentoring. It's very important to have that. And there's not a lot of things like that out there. And I appreciate the friendship. And I thought for all these years that the reason we talked so long is because you were in front of me in line and I was really hungry.
No, I finally found a dentist, other than my 3 friends that I have are dentists, that wanted to talk longer than 2 minutes, you know? So I call you my very first dental implant best friend, and I'm happy to have that relationship.
Thank you so much, Andrea.
And thank you for joining the podcast, and we will be talking a lot soon. Thank you so much.
Thanks for having me.